Dr. Ken Landa. Let's talk about Addyi. Addyi is a new drug available for treatment of hypoactive sexual desire disorder. The condition means what it says. It's women, premenopausal women, who have a decrease in their desire for sex that causes some distress, significant distress, and causes some interpersonal relationship problems. Well, as with anything else in medicine, we have to exclude certain other causes. So it's not associated in this case with either depression or anxiety, other medical conditions, for instance, cancer, heart disease, lung disease. It's not associated with having major problems in your relationship, and it's not associated with taking other medicines that might interfere with your interest in having sex. Overall, it seems that sexual disorders occur in anywhere between maybe about 10 and 40% of women, and if we look at hypoactive sexual desire disorder in premenopausal women, maybe about 10% of all women, or 5 million to 6 million women here in the United States. The pill, Addyi, or flubanserin, is a pink pill. A lot of people call it the pink Viagra or the female Viagra, but it's not. Viagra, the blue pill, is for men. It increases the blood flow to the penis and can be taken whenever one wants to have sexual relations, as opposed to the Addyi that has to be taken on a daily basis, and it works on the brain. It works to increase certain neurotransmitters, certain chemicals in the brain, dopamine and norepinephrine, and it decreases the amount of serotonin. Supposedly that's what makes it work, but we really don't know that that's indeed correct. The drug was originally developed by a German pharmaceutical manufacturer. They tried it for depression, didn't seem to work, so they tried it for hypoactive sexual desire disorder, ran into some problems at the Food and Drug Administration, so they gave up on the pill. Then the pill was sold to a company known as Sprout Pharmaceuticals. Sprout Pharmaceuticals tried to get the FDA to approve it, ran into some roadblocks, so they mounted a major campaign called Even the Score. They claimed that there was sexism at the Food and Drug Administration. They claimed that there were 26 medicines available for men who had difficulty with sex, but that's Viagra and testosterone and the related compounds. They had lots of women's groups that were actively militating for approval of this medication. They even had people going out and tweeting. Some of them were doctors who were even being paid by the company. That was unknown to the people who were reading all of the tweets. So, in the end result, they presented the evidence to the Food and Drug Administration, and they said that they could increase the number of sexually satisfying experiences by 1 a month. That's right. Not a major improvement. 1 a month. That's barely scientifically meaningful. So, the Food and Drug Administration considered the evidence. An advisory committee in June of 2015 said, well, okay, you can approve it. They voted 18-6 in favor of approval. That went on to the full Food and Drug Administration that in August of 2015 approved the drug, and within 48 hours after they approved the drug, guess what? The company was sold to Valeant Pharmaceuticals for $1 billion, with a B, billion dollars. Now, Valeant has had lots of problems recently with some ethics, with some price raises, price increases. They're being investigated by the Senate. They're being investigated by the SEC. They have lots of problems with some of the other medicines. They have problems with their marketing approach. The company said that they would pay $500 million cash right at signing, another $500 million in early 2016, and then some extra money depending on whether the drug met its milestones. But unfortunately, it isn't meeting its milestones. Viagra, on the other hand, when it was approved in 1998, within the first month, had about 600,000 prescriptions just in that 1 month alone. And even now, for 2015, total sales per year were about $4 billion. On the other hand, Addyi, in its first month, had 227 prescriptions. That's right, 227 prescriptions. So it's selling at an annualized rate of about $11 million. The company had hoped for somewhere between 100 million and 150 million. And remember, they spent $1 billion with the B dollars to buy the company. Well, a recent analysis in JAMA Internal Medicine looked at the drug. They looked at 5 published studies and 3 unpublished studies. And they looked at the patient's global assessment of improvement, and they found it was minimal to non-existent. And then they looked at the number of sexually satisfying exposures or experiences per month, and they found that with the Addyi overall, there was about 1 extra sexually satisfying experience every other month, maybe even every 3rd month if you look at the unpublished studies. And the real problem with Addyi isn't that it doesn't work, and it doesn't seem to work very well at all, but the problem's with the side effects. Side effects has big black box warning. If you take the drug, you might become hypotensive, your blood pressure might crash, you might become dizzy or even faint, lose consciousness. Think of that as a date rape drug maybe. Oh my God, this is not a good drug, good situation at all. A lot of the people who take the drug suffer from dizziness or sleepiness, somnolence, nausea, fatigue. Some of them even have insomnia. Dry mouth is another common complication. They looked at women who took the pill for a year, and if you take the pill for a year, the likelihood of a side effect is about 40%. Significant side effect is about 8%. And there's another problem with this drug. If you happen to drink alcohol, even an occasional glass of wine, that's going to increase the likelihood that you're going to have a problem with falling blood pressure or fainting or loss of consciousness. So you have to be very careful. And there are a lot of medicines that are going to interact that are going to cause the same sort of problems potentially. And those drugs might be as simple as erythromycin or Biaxin or maybe St. John's wort or maybe ginkgo or resveratrol, or maybe you're taking Tagamet. Got to be very careful. Maybe a hepatitis C drug, an HIV drug, or even if you're a woman and you have a yeast infection, taking something as simple as diflucan. Well, if you take the drug and you don't find it benefits you, you ought to stop after about 8 weeks. Now, here's another problem with the drug, major problem with the drug, and it's the cost. If you look at goodrx.com, the cash price for the drug is a little more than $800 a month, or $27 a pill, or more than $9,000 a year for a pill that's associated with a lot of side effects and probably doesn't work very well. Well, there's another problem with the pill. It's considered a lifestyle medication, and some insurance companies and some pharmacy benefit managers say we're not covering the drug, or if we do, it's going to be on a 3rd tier. So you're going to have to pay a lot for it, supposedly. So bottom line, we have this pill called Addyi. It's been highly promoted. It doesn't seem to work very well. It costs an awful lot of money, and it's associated with a significant number of side effects. So do we have an answer for hypoactive sexual desire disorder? Answer is in women, premenopausal women, not at the present time. Anyway, thanks for watching. I'm Dr. Ken Landau.